Are you finding it challenging to navigate the maze of Medicare supplements and Part D plans? Well, you're not alone. Transitioning to Medicare or changing plans can be very daunting, especially when it comes to ultimately deciding on the specific Medigap and Part D coverage that you want to enroll in. In today's video, we will dive into this process to help you understand the different types of Medigap and Part D plans that are available, and more importantly, how to select the right coverage based on your unique budget and healthcare needs. At our company, Giardini Medicare, we have enrolled thousands of people in Medigap and Part D plans over the years by using the same exact methods that we will show you in this video. So we want to pull back the curtain to share these details directly with you. But before we proceed, let me clarify something. In this video, we will not be talking about Medicare Advantage plans. That is a topic that we have devoted a separate video entirely to, and we encourage you to check that out if you are interested in trying to find a Medicare Advantage plan or to compare it to Medicare supplements. Also, during this video, remember that the specific Medigap and Part D plan options, pricing, and coverage can vary greatly based on your state and even the zip code that you live in, so make sure to consult with an independent broker about specific options where you live. If you need help connecting with one, you can use the link down below in the description of this video. Another thing to note is we are going through the process of finding Medigap plans in this video with the assumption that you are new to Medicare Part B and therefore eligible for Medigap open enrollment period. This means you will not have to answer health questions to qualify for a Medigap plan. Now, if you are past your Medigap open enrollment period, much of this overall process is still going to be the same, but remember that in most states and situations, you will have to qualify for a new Medigap plan based on your current health and pre-existing conditions. Lastly, while we aim to give you a thorough understanding, this video guide is not going to give you exactly which Medigap and Part D company will be the right one for you, so make sure you take the proper steps after watching this video to find the exact Medigap coverage and Part D coverage that you want. But that's enough disclaimers, let's dive in. First, let's understand what Medigap plans are and how you can figure out the plan options that are available in your area. Medicare supplements, which we refer to as Medigap plans, are simply insurance policies offered by private insurance companies that fill most of or all of the financial gaps left by original Medicare, which is Part A and Part B. This includes costs such as co-payments, co-insurance, and possibly deductibles. So these plans, they work in tandem with your original Medicare coverage, and with original Medicare remaining your primary coverage and Medigap becoming your secondary insurance coverage. Now, the first crucial point to understand about choosing a Medigap plan is that they are standardized. But what does this mean? Medicare defines it as the following. Each standardized Medigap policy under the same plan letter must offer the same basic benefits no matter which insurance company sells it to you. Essentially, if you compare Plan G from Company X and Plan G from Company Y, both will offer the same basic medical coverage. It does not matter which company you purchase it from. Although basic plan benefits are standardized by the different plan letters, the monthly premiums for plans with the same plan letter can and will vary from one insurance company to another. And as we will talk about, unfortunately, choosing a Medigap plan, it is not as simple as choosing the cheapest plan available in your market. Luckily, plan standardization allows you to compare plans with different insurance companies with much more ease. However, there is a bit of an added wrinkle when it comes to Medigap standardization. Just because Medigap plans of the same plan letter have the same basic benefits, it does not mean that the insurance companies can't also offer extra benefits with their Medigap plans. For example, a Plan G with one company may only cover the base benefits they have to, while a Plan G with another company might cover those same basic benefits while also including coverage for other services not normally covered by original Medicare. To explore the different standardized Medigap plan letters available to you, an excellent resource is the official Medicare and You handbook. This handbook is published directly by the Centers for Medicare and Medicaid Services, and it is updated annually. It provides comprehensive information about all things Medicare, but you can specifically find details about all standardized Medigap plans on page 76 of both the 2023 and 2024 version of this handbook, just like you can see here right on the screen. The Medigap plans currently available to you may include A through N, as you can see on the same chart. chart, as well as high deductible options for both Plan F and Plan G. This will depend on when you first become eligible for Medicare, which we will highlight shortly. We will have a link to a PDF of this handbook in the video description down below, but Medicare should send you a physical copy of this when you are Medicare eligible. Navigating all of these options, it seems overwhelming, so where can you turn for help choosing Medigap coverage? Again, this is where a good independent broker can help. An independent broker's role is to simplify finding a suitable Medigap plan for you. Independent brokers like ourselves have access to dozens of Medigap plans that we contract with in most areas and can offer you unbiased advice, saving you from the time-consuming task of calling each insurance company to try to get separate quotes. We have the expertise to guide you through the decision-making process, and we can provide tailored advice based on your specific needs. Of course, we are probably biased in believing brokers are your best option, but give it a shot. Whether it's us or somebody else, we really don't think you'll be disappointed. Now you might be thinking, can I just call Medicare or use Medicare.gov to compare Medigap plans? Well, unfortunately, while Medicare.gov is a useful resource, it does have its limitations. The website can be a good place to start familiarizing yourself with Medigap plans that are in your area, but it will be difficult to use this as your only source to narrow down specific plan options. As we mentioned earlier, choosing a Medigap plan, it is not as easy as choosing the cheapest plan on the market. So as you can see with Medicare.gov, the only way to learn more information about the different insurance companies offering Medigap plans is by calling or going to the website of dozens of different insurance companies that offer these plans, and you would have to do so one by one. You could also try calling 1-800-MEDICARE directly for more information, but in our experience, the representatives on the phone, they will give you virtually no helpful information about Medigap plans. Give it a try if you want to test it. Independent brokers can utilize specialized software that can show you most of the Medigap plans in your area, along with the prices in an instant, which you can see an example of right here on the screen. We can also easily see the different household discounts that are offered by different Medigap plans, and we can see if they require an additional application fee for you to apply for coverage. Perhaps most importantly, we can discuss the different insurance companies offering plans in your zip code and provide more in-depth feedback about which one might be right for you based on having several years of experience seeing plans come and go from the Medigap market. You might be surprised to know that every year there are several new insurance companies offering Medigap plans that will enter and exit the market, which can be important for you to know for the long term, but if you call an insurance company directly, it is unlikely they will tell you much information about their competition and their plans. And here's the best part. We offer the exact same prices and products you would get by going directly with an insurance company, and our services, they cost you nothing extra. Since instead, we are paid commissions from the insurance companies we represent when we enroll you in a plan, and we even highlight the commissions that we earn in another video in case you are concerned with any conflict of interest. Last but not least, we offer our clients as much customer service and claims support as possible for as long as they remain clients with us, so whenever possible, you can avoid calling the 1-800 number of an insurance company if you have an issue, and instead you can call your broker or ourselves directly. Regardless of how you get help choosing a Medigap plan, it is important that you directly consult with somebody familiar with Medigap plans in your state. Many people are surprised to find that Medigap plans are regulated by individual states despite Medicare being a federal program. Where you live can impact the pricing of Medigap plans, how Medigap plan premiums increase over time, and perhaps most importantly, even your options when it comes to changing to a new Medigap plan in the future. Watching YouTube videos, it can help familiarize yourself with Medigap coverage options, but it is impossible for us to give everyone the personalized information they need in one or even multiple videos. So real quick, we do also have a new free online course you can sign up for to learn about hundreds of Medicare topics at your own pace, so make sure to register for that by going to gmedcourse.com. So now that you are familiar with the different Medigap plan letters and you know where to get help, let's focus on the details of choosing your Medigap and Part D coverage. First, it's crucial to understand which Medigap plans you are actually eligible for. If you are eligible for Medicare before January 1st, 2020, you could purchase all of the Medigap plan letters available on that chart we talked about on page 70 76 of the Medicare and You Handbook. This includes Plan C and Plan F. However, if your Medicare eligibility first began or will begin on or after January 1st, 2020, you would not be eligible for a Medigap Plan F and Plan C. Knowing this can save you time and energy when considering different Medigap options. Also, keep in mind that Medicare eligibility is not the same as Medicare enrollment. For example, if you turned 65 in 2019, but you didn't enroll in Medicare at that time, you are still likely eligible for coverage even though you were not technically enrolled in Medicare. With that in mind, let's move on to choosing your preferred Medigap plan letter. I understand the array of options can seem overwhelming, however, we will simplify things for you. You want to strike a balance between the coverage that you desire and the price you are willing to pay. As a general guide, we often recommend either Medigap Plan N or Plan G, even if you're eligible for a Plan F or a Plan C. And you can also potentially consider a high deductible Medigap plan depending on your state and your healthcare needs, but we will have much more details about those plans in another future video. Now, I can see the question forming, why Plan N or Plan G? What about the others? Frankly, most of the other standardized Medigap plans like Plan A, B, L, M, K, etc., they rarely end up providing the right coverage at a reasonable price. Also, in regards to Plan F and Plan C, because they are not available to newly eligible Medicare beneficiaries now or in the future, we typically recommend against those plans due to the long-term potential for higher monthly premium increases associated with those plans. Sticking to the most popular plan options like Plan G versus Plan N, when possible, will make your decision process much less stressful. Now, to learn more about Plan N versus Plan G, before even talking to a broker, make sure you watch our other video that goes much more into detail about each of those options. Now that you have a handle on selecting a Medigap plan letter, let's shift gears to discuss how you can choose a specific Medigap plan from one of the insurance companies providing Medigap plans in your market. This can seem overwhelming since, for example, in our home state of Michigan, there are over 40 different insurance companies offering just Plan G alone, with many offering essentially the same coverage. So let's debunk a few misconceptions right off the bat. First, the insurance company providing your Medigap coverage, it won't impact your network of healthcare providers. Medigap plans, they allow you to seek care from doctors or hospitals nationwide that accept original Medicare, regardless of the name behind the insurance company providing your Medigap plan.
And I can go anywhere I want?
Because Medigap plans are secondary to Medicare, you just have to make sure a provider accepts original Medicare since they will be billing Medicare as your primary coverage. We often have people tell us that they called their doctor's office and the office said they are not in network with the company providing the Medigap plan they have, but that is because the provider's office is simply misunderstanding the question and they are treating it like a normal health insurance policy or even a Medicare Advantage plan. Simply put, if your doctor accepts Medicare and they are accepting new patients, they must accept your Medigap coverage as secondary coverage. There is a natural inclination to choose to enroll with a company whose name you are familiar with. However, since all Medigap plans are standardized, you are not necessarily getting better coverage from one company over the other. But standardization also creates another unique dilemma. You may think, well, I'll just pick the cheapest plan available since they are all the same.
That's a great idea.
Unfortunately, as we briefly mentioned earlier, it is not that simple. Medigap monthly premiums, which are what you pay per month to have the plan in place, they can and they will increase over time. And these increases, they can vary wildly from one carrier to the next. Sometimes the company that does offer the cheapest plan might be the right choice, but many times the cheapest Medigap carrier initially might not remain that way for years to come. For example, on the screen, you can see a few real examples of a few different insurance companies that offered some of the cheapest Medigap premiums in Michigan in the past, and you can see the trend of their rate increases since then. That is why it's important to look into insurance companies with a broker and consider companies with a large amount of Medigap enrollments, strong financial backing, and at least some history of premium stability. While it is all a bit of an educated guess, informed Informed decisions are our best shot at choosing Medigap coverage for the long run. Moreover, while core medical coverage details are standardized, some Medigap carriers offer additional or extra benefits not covered by original Medicare. So if these additional benefits are important to you, you might want to factor them into your overall decision-making process. The reason choosing an initial Medigap plan can be so important is that they are lifetime contracts. So as long as you pay your premiums, your plan will remain active. In most states, you'll need to qualify based on your health and pre-existing conditions if you want to change to a new Medigap plan, which does mean this decision might be long-term depending on your state's specific rules and based on your health. Also, it is very important to know that the fall annual election period from October 15th until December 7th, it does not provide the opportunity to change Medigap plans without health questions, although many people think that. These factors should be what brokers consider when helping you find a plan long term. If you want to learn more about how Medigap plans increase their premiums over time, make sure you watch our video that covers that exact topic in much more detail. So when it comes to choosing Medigap coverage, first, it is important to understand the different Medigap plan letters and specifically which ones you are eligible for and which ones may work for you. Then, with the help of a broker, you can get specific pricing for many insurance companies that offer Medigap plans in your area, and you can hopefully choose a solid plan and company that will be right for you for many years to come. We don't often worry about chasing plans with the cheapest possible premium or going online and looking at online reviews of insurance companies because, let's face it, no one goes online to say nice things about an insurance company. I know I don't, at least. Instead, try to narrow down options by focusing on insurance companies with several years of experience in the Medigap market with at least some history of stable rate increases so you can set yourself up for as much success as possible in the future. So now that we've had our fun with Medigap plans, what about your prescription drug coverage? This is exactly where choosing a Part D plan comes into play. It is essential to realize that your Part D coverage choice is completely unrelated to your Medigap decision. In fact, you can and often should choose a Part D plan provided by a different insurance company than your Medigap plan. Why? Well, because your Part D coverage should only be chosen based on your unique prescriptions that you are taking and your individual coverage needs. Part D prescription plans are provided by private insurance companies that contract with Medicare to offer plans. Luckily, finding Part D coverage is more straightforward than choosing a Medigap plan. To find a Part D plan that suits you, we highly recommend using Medicare.gov. You can enter your zip code and a list of specific prescription medications that you are taking, as well as your preferred pharmacies. The website will then show you a list of all of the Part D plans available in your area. It will even sort the results from the lowest to highest overall out-of-pocket cost. There are various factors that will ultimately go into picking a plan, but generally we recommend choosing a plan that shows up close to the top when sorting by the lowest overall premiums plus out-of-pocket cost for your prescriptions. Again, this might be a different insurance company than your Medigap carrier, and that is perfectly fine. For a more detailed step-by-step guide for how to use Medicare.gov to find Part D coverage, make sure to watch our Choosing a Part D video after this one. Unlike with Medigap coverage, an important thing to remember is that Part D plans, they are yearly contracts. This means that you have the flexibility to change your coverage every year during at least the annual election period, which is the time from October 15th to December 7th, and there are also potential other enrollment period windows. The annual election period gives you a window to assess your needs and modify your Part D plan if necessary. So focus on finding a plan that fits your current needs for the year and really just don't stress too much about the future what ifs. Remember, your healthcare needs can change and so can your Part D coverage. The critical takeaway here is that the choice of Medigap and Part D plans should be based on your needs and wants. Your health coverage is a deeply personal choice and it should reflect your unique circumstances. Remember, it's about striking a balance between the coverage you desire and the price you're willing to pay now and in the future. Don't forget to leave us a comment below this video if you have any questions about choosing Medigap and Part D coverage, and subscribe so you don't miss future videos from us.